Littleton Board of Health Wednesday, April 14th, 2020 Zoom meeting. Follow the same rules as before. No chatting. And if you have a question, please raise your hand and state your name and address and keep yourself on mute until we call on you. So we're going to start off the evening with Jim at 7 p.m. The public hearing about 4 Berry Bush Civil Solutions, the variance request. So Jim, can you start us off?
Are they here? Is Kurt or Kevin here to?
Yeah, is Civil Solutions here, Dave? Or Janet?
Putting him in now.
Hello, can you hear me?
Hi, Kirk. Yep, we can hear you.
Hi, good evening. Kirk Fitzpatrick with Civil Solutions. I'm here on behalf of Vinnie Jant for his property at 4 Berry Bush Road. Let me share the plan here. So basically what we have proposed before you is a proposed upgrade for the existing 3-bedroom dwelling. The system is currently in failure. The current septic tank is located behind the house where the hand is hovering. And then it's got a leach field behind the tank and the flat area behind the house. But further behind the house is a bordering vegetated wetland. And that wetland actually wraps across the back of the property. And this line here is the 100-foot buffer zone associated with the edge of the wetland. So if we put any new system in the rear yard, it would have been within 100 feet of wetlands. Vinny had mentioned that he thought the front yard was all filled in when they built the house. It actually used to slope off fairly steeply off Berry Bush Road and then flatten out towards the back. So he thought the front yard was all filled. So we did some test holes in the front yard, test holes 1 and 2, where we found 5 to 5.5 feet of fill material and a seasonal high water table at 5 feet. And it was too wet to run the perk test. We actually had conserved water right at the change in material. So we took a soil sample, sent it into the lab, and it came back as a sandy loam. So what we're proposing is to come out the back with a new septic tank. The plumbing is actually under the basement floor, so it can't be changed. So we're going to come out the back to a new 1,500-gallon 2-compartment septic tank. That's going to feed a 1,000-gallon pump chamber, and that's going to pump the liquid up to the front yard, actually across the water line through a sleeve to a leach field composed of the Presby Enviro septic. That's going to be 32 feet long and 19.5 feet wide. With the use of the Presby, we're asking for a reduction in the groundwater offset from 4 feet to 2 feet, which allows the system to just barely stay in the ground, and it won't change the grading in the yard. The yard does slope off the street down towards the house, so we wanted to make sure we didn't change the grading and cause any drainage problems with the front of the house. In addition, we're asking for a variance to reduce the offset from the street sideline from 10 feet to 8 feet, which is really just right here in the corner where the distribution box is. And we're asking for use of the particle size analysis where we couldn't run a percolation test on site. And I'd be happy to answer any questions the boards may have.
What did you say goes underneath the house, Kirk?
Also, presently there's plumbing in the basement. So the building sewer exits up below the basement slab. Sometimes we can switch around the plumbing in the basement and bring it out the front and put the tank in the front and maybe make it by gravity. But in this case, where it goes under the floor, it's got to be a pump system.
Okay. All right. Does anybody have any questions for Kirk?
Nope.
All right. No questions from the board?
Nope.
All right. And Jim, do you have any questions or do you have any comments, Jim?
Again, this is an upgrade, and fortunately, the front yard was filled at some point in time, so now they can actually install that system in the front yard without a big mound in the front of the house. I think it represents a good fix for the property the way it is. It's a little complicated by having to go around the house to pump up, but otherwise it fits in there pretty well.
Right.
And shouldn't affect any abutters?
Should not.
Okay. Anybody have questions for Jim?
No, thank you, Jim.
Thanks, Jim. Okay, so, can I get a motion, to accept the, variance from someone? There's,
I make a motion to.
three of them?
Variance.
There's three of them?
I already made the motion.
I'll second the motion to accept the 3 variances.
Okay,
Thank you,
all
Mike.
right. Thanks, Kevin. So, go by roll call, Kevin Baker,
Kevin Baker, yes.
Gino Friloni,
Gino Ferraroni, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin. Read your lips. Did you say yes?
Mike Selden, yes.
And again, yes. All right, thanks, Kirk.
Thank you. Have a good night.
You too. Okay, and the next one, well, I guess we're a little bit early. We have 7 minutes. Can we have Jim talk about it before? Is that okay for you to talk about it, Jim, before the time?
I mean, I can, I don't want to steal his thunder, but it's essentially a replacement system for the structure. I think he can explain more why they're doing it. I think it has to do with having to do some parking and some other zoning requirements on the site. So they got to move the system. The variant that's required is that the property sits within your aquifer recharge area. And because it's not just a single family house, they're restricted to a certain number of gallons per 1,000 square feet. And the site was pre-existing and exceeds that. So to mitigate that situation, they're going to put treatment on the septic system when they reinstall it. So I don't see an issue with it, but he can explain fully. I think I got the situation right, but he can probably better explain.
All right, and Janet is it McCarthy Company? Laura Green, is he in the?
He's on his way in.
Okay. Mr. Green, we just have to wait until 7:15
Oh, sure.
because that's when it's on the agenda.
Awesome. Thank you.
But you could make sure that you're all
Your
set
screen-
up and share the screen.
I'm trying. I'm getting
Yeah.
assistance.
Perfect. Thank you.
Oscar vacancy.
Can you see my screen?
Yes.
Awesome. Thank you.
So Lisa, was that 32 mil on the agenda?
It's not on the agenda.
Okay, because
He just called me yesterday, Jim, and said he had spoken to you, and it was just really sort of a quick no abutters needed to be notified. It was just a quick discussion, and could we squeeze him in under public comments?
yeah, now I'll send you my comments to the owner. What they're essentially looking to do, and if you don't mind, Liz, I can kind of give you a little bit of background so that the property there was a repair done on it. I think it was done pretty close to full compliance at the time and made big enough for a 4-bedroom, but they didn't do all of the testing that's required to make it a 4-bedroom. So you need to, one of the biggest things is a reserve area. Your regulations have changed some, so I think the letter represents they don't want to have to change out the single compartment tank. They just want to put a filter in it, so they may need to ask for a variance for that. But what I did was I listed for him the things that they needed to do, because what he essentially wants is the board to issue a certificate of compliance for a 4-bedroom house instead of a 3. And I want to make sure the paperwork truly reflects that it complies with a 4 before we change that certificate of compliance. So.
All right. So I guess if he shows up in public comments, we'll tell them that we have to continue it. We can't really discuss it. He should discuss it with you first.
Sure. I haven't spoken with him, I don't believe, Steve Poole, about this site. At least I don't remember. But if I had, I would have sent him the email because I've sent it to at least one other engineer asking the question about this property.
Okay.
There is a Steve in the audience, but I don't have a last name to know if that's him or not.
There are a couple hands up. I think Steve's one of them.
If you have a question about
Do you want,
the people with their hands raised, are these questions about point if we're just dealing with the public hearing of 22 King Street right now. So if your question is about something else, if you could lower your hands, we'll get to you after we have a discussion. Which starts at 7:15.
So quiet.
Okay, Mr. Green, if you want to get started.
Sure. So good evening, Larry Green, McCarty Engineering. I'm here on behalf of JRI, here to present their variance request for this property situated at 22 King Street. This variance request pertains to the building and the use maintaining its existing effluent loading rate, which exceeds the allotted gallons per day per acre within the Aquifer Protection Overlay District. Just give you a quick background on the site. So the site, they say it's stated at 22 King Street. It's approximately 2 acres in size. It's situated on that kind of that hard corner on King Street. Gas stations across the street. You have the music place to the right. Then within the site, you have the existing building here. It's the existing boarding house. Behind that's the classroom. Then over here to the front of the site is a looping driveway. And then over here to the kind of left of the site is the existing septic system and tank. That system was approximately built in early 1990s, 1992, I believe, with a loading rate of 2,370 gallons. Then to kind of give you, kind of the whole picture is earlier this year, we were in front of the planning board to requesting and obtaining site plan approval to construct a new parking lot situated here. And as part of that, these site improvements, JRI would also like to improve their existing septic system and kind of be more stewards of the landscape, because right now that the design flow exceeds that 6 gallons per thousand. So what we're proposing to do is, here's a kind of a blow up of the proposed septic system. Here's the new parking lot. We're planning to remove and abandon the existing septic system here, install a new 7,000 gallon tank, 7,500 gallon septic tank, a pump chamber, which will pump up to two 1,500 gallon jet denitrification tanks, and then that'll then flow gravity into approximately a 2,300 square foot Presby leach field. So we feel that with these improvements, we're trying to basically, again, we're trying to maintain the existing effluent design flow, but we're trying to provide enhanced effluent treatment and also storage. That's basically a quick summary of what this variance request is about.
What exactly are you requesting for variance?
Basically requesting the variance is to maintain the existing design flow of 2,370 gallons per day, which is the existing flow, but yet it exceeds the load-in rate, which you have stated in your local bylaw with lots within the Aquay Protection Overlay District.
Oh, okay. All right. Does anybody have any questions for Mr. Green? Okay.
I'm sorry.
Jim? Oh, go ahead, Kevin.
Yeah, I have a question. You mentioned that this exceeds the restriction.
Correct.
And what is what we'll call the governing body that has this restriction, that put this restriction in? Is this from the planning board on a zoning basis?
No, I believe it's your local Board of Health bylaw that states that lots within the Aquay Protection Overlay District, your effluent loading rate is 6 gallons per 1,000 square feet of lot area.
Okay, so the origin of this is Board of Health.
Correct.
Okay, I just want to clarify.
Sorry,
No, I missed it. It's fine.
I probably rambled. My apologies.
Nope.
Kevin, you had your hand up?
How many square feet is the building?
The building, all the buildings are existing. No new construction is being proposed as part of these buildings.
Right, but the gallons per day is based on the square footage of the building.
No, the original design was based on, I believe, 13 residents and then a 22 staff. Was kind of how they came up with that. It's about 1,100 gallon plus or minus, and then they basically doubled that per the water reading. Then I can zoom in if you'd like. And then we took water readings to base. If I can pan over. So here's kind of what the original design flow was based on that 1,185 gallons per day. They times it by 2, got that 2,370 gallons per day. Then you can see through 2018, 19, 20, they averaged about, for simple math, about 1,000 gallons per day per year. So basically doubling that. We're still under that 2,370 gallons per day per acre.
Any other questions from the board?
I have a question, Lisa.
Sure, Louise. Go ahead.
And do you know if the number of people has changed since they?
A tiny bit, like if you can see right there, it says current condition. It's basically 15 residents and at a peak, it's 23 staff. So it's slightly bigger than the original design, but we're still the water usage has actually been going down. So we're still right around that 1,000 gallons per day.
Okay.
You can see it right there in 92 it was 13 residents and 22 staff, and now we're at 15 residents and 23 staff. So we're plus or minus right around the same.
Okay.
When we zoom in, I got bad eyes.
I think we can see it.
I see. Yeah, I can see it.
Did you conduct any new test holes?
Yeah, we did. We did testing, which was witnessed by Mr. Griffey. Kind of situated here. We have, I could test hole here, test hole here. We also did, and then we have other testing. It was all coarse stratified sand and gravels, no modeling, no groundwater.
It was 2 minutes an inch,
It was. Yep, it was.
and your offset will be 3 feet.
Our offset is actually going to be approximately 10.
Oh, great.
We had the 5 foot offset, and then we incorporated the groundwater mounding, which is approximately 1.5 feet. So the minimum was like 6.5 was the required offset, and we're proposing approximately a little more than 10 feet.
Awesome.
May I ask you a question, Lisa?
Question.
About how far are you from the high school?
Not too far.
Are you asking me?
Yep.
Oh, so me zoom out, I apologize. I think you're a couple lots over. So here's our lot. I think this is the music place. So I think the high school is, a little farther to the right of my mouse.
Okay. And I'm asking this not because I want you to change direction, but you do realize that you are within shouting distance of the proposed support facilities for the anticipated sewage system, a real one for the town, right?
Yes. Yes.
Okay.
Are you proposing they tie in, Mike?
I can't propose anything. I'm just,
Raising.
shall we say, disappointed. Let's put it that way. Not in your proposal. It's just that it's tough that that someone has to go to this route.
It sounds like they want more storage and more parking probably soon too.
That's exactly, yeah. I mean, this is a tangent. This is exactly a case where a municipal sewage system would make it not only possible, but shall we say, easier. And for all I know, I'm not sure from the sound of it, less expensive, but I'm just guessing.
Oh yeah, I would say that. Yeah, that connection would be more cost effective.
So, yeah, what's their timeline? Could they wait? I mean, I know it changes everything, but
it does. I know. I don't know. I know they are. There's a demand for this parking. So as part of that parking, that I believe that's going to be this construction season. Then as part of that construction project, they got to provide underground stormwater management, and that stormwater management area is going to be in the area of the existing leach field. So I think that's going to semi-mandate us to install the new septic system because we need that.
But are they aware of this sewer project?
They are aware of it, but I don't believe they're aware of that. The ability, I guess, their ability to tie in this quickly. I guess we were not aware of that. We knew of it, but didn't know of it.
Right.
All the dirt over there is pretty valuable too. All that sandy gravel.
Jim, do you have any comments at all?
No, again, I think the upgrade will make the effluent quality much better because of the treatment. So I don't have any issues with the proposed variance.
All right. Is there anybody with their hands raised at all, Janet?
Yes, Sandra Casal has her hand up. You may speak.
Sure, go ahead, Sandra. Is this about the 22 King Street project? Because I know you're on for the Country Gardeners plant sale. Sandra?
Hello.
Hi.
I'm sorry, I didn't mean to have my hand up. I'm having problems with my Zoom. My commands aren't coming up on my screen, and I'm panicking a little bit.
We're going to be talking about King Street and the library before we get to you. So
yeah, no problem. I'm just saying that's what I'm doing.
Okay. All right.
I'm fumbling a
All
little.
right. So anybody with their hands raised regarding the 22 King Street public hearing?
That's it. There are no other hands raised.
Okay. So can I get a motion to approve the
Make a
variance?
motion to approve the plan as presented.
I second it.
Okay, thank you. We'll go roll call. Kevin Baker,
Kevin Baker, yes.
Fiona Fratelloni,
Faroni, yes.
Louise Nichols. You got it on
Louise Nichols, yes.
Mike Zeldin
Mike Selden, yes.
and Lisa Flanagan, yes. All right. Thanks, Mr. Green.
All right, thank you. Enjoy your evening. Thanks so much for your time.
Thanks.
Good job.
So next on the agenda at 7:25, right on time, is a discussion regarding the library book sale. Is Sarah Rambacher here, is attending?
Yep, moving her over.
Thanks. Jim, do you still have a minute?
Yep.
Wrong, Sarah. Janet.
Jim, are you leaving early or?
I have to go to the Boxborough Board of Health meeting.
Okay.
Hi.
Hi, Sarah. So just going to discuss your book sale.
Yeah, so I'm with the Friends of the Library. We're planning a book sale for May 1st and 2nd. Sorry, get my cat out of the way. I sent you guys a detail of our plans. Do you want me to go down through all that, or just a summary?
If you could just do a summary, that'd be good.
Okay, so basically it would be Saturday and Sunday, May 1st and 2nd, running from 10 to 3. And it would be on the lawn in front of the Shattuck Street building. We're planning on putting up a large tent to protect from the weather, but there would be no sides. We would have the tables, most of the tables under the tent there. We'd be setting up on Friday. The National Honor Society is volunteering to set up. So there would be about up to 15 National Honor Society volunteers doing that on Friday. And then as the sale runs, we plan on limiting the number of people in the shopping area to 25. And any people waiting would be lined up, spaced out along the sidewalk, running down Shattuck Street in front of the building. We'll have a volunteer who will be taking contact information for contact tracing if that's necessary. We will have signs posted to remind people to actually not to come if they're not feeling well, to hand sanitize, to wear masks at all times, and to maintain distance. We'll have volunteers, sort of just a couple, to keep an eye out. If people do start clumping up, they can remind them gently to space out. Let's see. We're also offering a service so that people don't have to come and can still buy books. So we have a form online that they can actually give us requests, and we'll fill a bag for them and do a contactless delivery. So that will, anyone that's not comfortable, or just to help reduce the number of people that may come to the sale. In our publicity, we're going to make sure that everyone knows that they'll be required to wear a mask, use hand sanitizer, maintain spacing, that they may need to wait to line up if the sales area is full. And we added, if you are not feeling well, please stay home and use our service instead to fill a bag for you. The National Honor Society for setup, as I said, there'll be no more than 15, and they'll be instructed with the same things. They'll be wearing masks. They will hand sanitize and maintain distance as they move. They'll be moving boxes of books from the trailer in the back of the library around to tables at the front of the library. I think that's about it. We actually did a similar thing in October, so we're basically following the same plan.
And you have Katrina on your board too, so that's a big help.
She is our advisor, yes,
yeah.
To make sure that we know what to do.
So I know Jim has to leave, so Jim, do you have comments? And then we'll ask our questions.
Well, thank you. I had talked to Sarah a little bit before, and it was quite clear that Katrina had talked to her already, so that was very good. We talked about the indoor-outdoor event standards, and again, what makes it a safer event? It's obviously outdoors. They can provide the distancing. having staff along the way to help remind people to do the social distancing, I think is really important, and making sure that people have masks. So I don't really see an issue with it. And when we talked, Sarah mentioned that they also in the past had people waiting cars, and they could call them if the lines get kind of busy. So that, again, regulate the number of people attending. So again, I think it's well thought out and shouldn't be an issue.
Okay. All right. Do you have to?
I do need to leave. I'm sorry. Thank you.
Thanks for staying.
Bye, Jim.
Thank
Hi,
you.
Jim.
Oh, Jim, you can't stick around for the country garden?
I cannot. I have a 7:30 meeting.
Okay.
What are the COVID numbers this week?
I gave them to Katrina. It was 28, according when I did the virtual. So, and 16 for the weekly number for the past week.
Thank you.
Yep.
Thank you.
Sorry.
Yeah. Sarah, what do you do? Do you do anything for like touching, like the people that pick up a book and touch it and then put it back down? Is that going to be covered by hand sanitizing?
I think that's covered. So we're providing hand sanitizer at the entrance and then at the exit, and in between their face is covered. And really, it's no different than going in a store and you pick up a box of cereal and put it back. So I'm not sure how we would manage sanitizing books if anyone touches.
The CDC has already said that hard surfaces are not friendly to the virus. So all that spraying and cleaning is for naught. We are the enemy. Okay. Not the hard surfaces.
Sarah, did you learn anything from when you had it in October that you'll apply to now?
Yeah, so the one thing was that we realized that a lot of people, especially book dealers, came right at the beginning. So we're going to be more prepared for that. We knew that we would line them up along the sidewalk, but we didn't have spaces marked. So we're going to make sure to have spaces marked all the way down. And we'll probably, there's something called the book sale finder that we publicize that a lot of book dealers find us on. So on that listing, we'll also mention that.
Mm-hmm. Great.
Any other questions for Sarah?
Very well thought out. Thanks for coming.
Yeah. Hope you have a good day.
Yeah.
Yes.
Good job.
Good
How
for
long
you.
are you accepting donations till?
We actually did a donation drive-through this past weekend, so that it was a little more controlled. The library, where they're open only in a limited manner, we can't have people drop off a lot of books there because we can't sort through them and take care of them. So we partnered with the National Honor Society, and they helped us to, we just had people drive through, we'd unload it onto a table and then stow it in the trailer.
And how is the new library going?
It's going great. You can see the siding is
When do
going
you
on.
expect to be open?
I believe the current date is September 1st, but I will defer to the trustees for and the director for a
This
definite
year.
date.
Good. Awesome. Anybody else have any questions or comments for Sarah?
No problems. Good luck. Hope it's sunshine.
This was just a discussion, so
Good luck with the new library.
Thank you.
okay. Thanks.
Great. Thank you.
Good. And I don't know if now we're moving on to the discussion of the Littleton Country Gardeners plant sale. And Sandra, you get your stuff working?
Sorry, I was on mute. I just got my commands back. Talk about panicking. And I'm in my still. I didn't mean to be in my still here. I usually have a background and you can see my lips. I have my share screen here. So I think I'm all set. So
Okay.
I'm Sandra Casali. I'm here to represent the Littleton Country Gardeners. And what we're hoping to do is we're hoping to prove to you that we can have a safe plant sale this year. every year we have a plant sale the day before Mother's Day, and I think the residents really depend on it every year. And I think more than ever, they probably need it this year for morale. And a lot of people also have been gardening. So I think it would be great if we could have it this year. I just put together a drawing to show you. Let me see. Here we go. Can you see it okay?
Yep, there we go.
Okay. All right, you got that? Littleton Country Gardeners annual plant stand proposal. And we just want to let you know that we're trying really hard to adhere to COVID-19 protocol. So what I have here is a drawing of the Littleton Common, a photograph of the Littleton Common, and the section that we utilize when we have our plant sale. The white, funny-looking shape is my table, and the red lines are leading to the table. We would have a sign at the beginning of that trail telling people that was spacing 6 feet apart from each other. And when you see those yellow dots, we would have either a pylon or a garden stake or both. The reason for the garden stakes is we thought we'd have like little signs for people to read while they're stopped in line. And the reason why I have 8 dots is that area is like 50 feet. And the most we ever have waiting in line is 8 people. So it was perfect to set up 6-foot increments for the 8 people there. And we would have a sign at the beginning instructing people to go through the line. The gray squigglies walkways through the plants, which are the green circles. We really will be spacing them out if we have it this year, and making sure that people aren't too close together. We always have our shade plants in one area and our summer sun plants in another. And this year, whoops. Can you hear me okay? Can you hear me okay?
Yeah, you're having an echo, or someone's introducing an echo.
Oh, I don't think that's me.
I don't
I
think
heard
it's
it.
either.
Is on twice.
Yeah, I don't think it's me because I heard it when I was on mute too.
Dave, is there any way that Gino looks like he's on twice?
Yeah, Gino, you're on twice, whether you realize it or not.
Freeze, Gino, that might be making a background noise.
There you go.
There you go. Good.
Not me.
Sandra, I've been to the plant sale, and there is a lot of commingling and walking around the groups of plants. Is there any way that you can space those out a little bit?
Definitely, definitely. In fact,
And like the library book sale, they are going to have signs and advertise for mask and hand sanitizer.
yes, we're going to do the same thing. We have flyers that we post around town, and on the flyer for the sale, on the bottom, it would say we were adhering to COVID-19 protocols. Please wear your mask and stay socially distanced. We were going to put that on social media and on the poster. And then we'll have signs also at the sale, and we'll have disposable masks in case somebody comes without a mask.
And you're brave enough to tell people to
Mask up?
hold mask up, and
Yes, definitely.
Yeah.
Yeah, and we'll have hand sanitizer too, and we'll be wearing gloves at the register. So we would take all the safety precautions, and we also would space out the people working at the plant sale. You know, the members of the garden club, we would space them out. And all our tables are 6 feet long. So we could either have one person at either end or just one person at the table taking the money. And we're going to have more tables this year than usual. We usually have a tent. And in the tent, we have like arrangements for Mother's Day. And we also have herbs in there. There's usually a ton of things under that tent. This year, we would make a lot less as far as the arrangements go. And we would have the herbs elsewhere on the grounds on a separate table.
Can you use a little bit more of that part of the common?
Oh, yeah, definitely. Yeah, it's just that, to give you a look at where we're set up, normally, I cropped it this way. But yeah, we can go over to the memorial on the
Yeah.
left.
Yeah,
And we can go over to the right past the little walkway near the, benches.
I think that would be a good idea to.
Oh, yeah, yeah,
Right.
this, I was just spacing up, showing you this direct area
Mhm.
that we're usually at.
Okay. Does anybody have any questions for Sandra?
Yeah, I have a question based on past history. Would you say that the average customer, your market, are they vaccinated? Do you think they're the vaccinated market or the unvaccinated market?
I would think that maybe 75% of them are in the vaccination market bracket.
Yep.
Yes, I think so. Yeah, I think about 75%. At least 75%.
Well, your treasurer will be pleased.
Yes.
Does anybody else have any questions for Sandra or suggestions? This is usually on the weekend of the elections too, right, Sandra?
Yeah, it's the Saturday before Mother's Day. This year it's May 8th.
And that's election day too, so.
Yes, yes, it's always on the same day.
Anybody, questions or?
Thanks for coming. Well thought out, and I hope
Thank
you
you
get
very
sunshine
much.
too.
I do like your comment, Lisa, of that spreading out more.
Definitely. Well, we plan to do that anyways, and we also plan to have less plants this year. So we can spread out more.
Yeah, looks great.
Thank
Great.
you.
All right, is there anybody in attendees or with their hands up at all?
No hands are raised.
Okay. All right, good luck, Sandra. Thank you.
Thank you very much.
Okay. All right. The 7:45 public hearing regarding park and rec and opening the basketball courts with Alicia. We talked about that last week, so we're going to move on to the COVID update. So Jim briefly gave it to us. Is Katrina here? Katrina? Oh, there's Sandra.
Yeah, now I'm in California. Quick flight. Whoops, I'm on mute.
All right, Katrina, whenever you're ready. Here you go.
Katrina, you're on mute.
Thanks, Sandra.
Thank you. When I get invited in, it reset everything. So give me a second. All right. How's everyone doing?
Great. How are you?
Hanging in there. All right. Let's dive in to the presentation. Okay. So unfortunately, I can't hear Jim's stuff. I always love hearing what he has because he provides insight you don't get from just the raw numbers, but we'll jump into what I do know.
Jim had to go to the Boxborough meeting tonight, so.
Understandable.
Yeah, he didn't have, he just had some quick numbers to give us, but he said he'd talk to you about them.
Yeah, he sent me the numbers, which was great. So here's the four main metrics that we've been talking about, and I want to just dive right into the last 6 weeks. So just like we've been reporting week after week, the number of tests conducted in the state of Massachusetts remains stable. And this is a really great sign because that means that any changes that we see in test positivity or the number of cases is actually related to changes in the disease and not changes in testing. So this is a great thing. So this is the test positivity. So reminder, this is the number of positive tests over the total number of tests conducted on that date. And the test positivity as of today, as of this week is 2.43%, which is actually about the same as it was last week. And the state now breaks it out by age group, and test positivity does vary by age group. And part of this is how many tests that age group's getting, how many cases are in that age group. So this is a little harder to understand, but you can see that 15 to 19-year-olds have the highest test positivity, and it has been rising in recent weeks and starting to dip back down. And then the next highest group is the 20 to 29-year-olds with about 15% test positivity. If we look at cases, which is a much more hard number and easier one to understand, so like our test positivity, we've kind of hit a little plateau over the last week, which is good. You can see that the 7-day rate flattened to about 1,800 to 1,900 cases per day. And the 7-day statewide incidence rate per 100,000 is 27.4, whereas last week it was about 28, so we're stable. So compared to last week, we did not go up or down. We're stayed the same, which is great. And finally, the state, like I said last week, broke the cases down by, for the 0 to 19 into 5-year age bands, which is really helpful so that we can really dig into some trends by age group, because that's really helpful to understanding where we might need to make some, focus some attention, right? So this is this is the new data as of today. Rate per 100,000. So we're controlling for population in each of these age groups. And as you can see, we have that bell-shaped curve right around the 15 to the 29 age group. Those are the highest rates here, these two groups. And then it dips down when you start thinking about family units. You're talking parents in these 30 to 59 age groups, and they're mirrored by the kids in the 0 to 14 age groups. This little purple one is the 60 to 69-year-olds who have only recently been prioritized for vaccine. And then with the lowest rates are among the 70 plus group, which is awesome because they have been prioritized for vaccines. So this is just this has happened in the last 2 weeks graph. When we look trends over time, you can see that this is from the end of October. If you look over time, you can see we went up and down again, but we're in this little section here at this point. So our 20 to 29-year-olds are the highest. And you can see this black line is the 0 to 19 age group. This is going to be hard to see. So now when we break that into 5-year age bands, you've got 0 to 4, 5 to 9, 10 to 14, and our 15 to 19-year-olds are mirroring the 20 to 29-year-olds. This makes complete sense when you're talking about behavioral and social patterns of these age groups, family structures, household structures, things like this. So the fact that we have our kids mirroring their parents and household spread makes sense. The fact that you have older teens, 15 to 19, some of which are in high school and some of which are in college, mirroring your young adults, 20 to 29, that also makes sense. The great thing I see here is these purple lines are our 70 plus, the 70 to 79, 80 plus group, and their rates have fallen and they have stayed steady and low since vaccination has been introduced, which is amazing. The 60 to 69 crew here is actually starting to rise back up. They've only recently in the last few weeks been prioritized for vaccines. So hopefully enough of this group starts getting vaccinated to have an impact on their rates. So that is something I'm going to track over time, because as age groups start getting access to vaccines, we want to see them all go down. So now we're looking at hospitalizations and deaths over the last 6 weeks. So here are the two lagging indicators. One concerning trend that has been over the last couple of weeks is that the hospitalizations have risen. So the 7-day average is 715 hospitalizations per day. Or 7-day average is 715 each day, which is actually similar, like a little bit higher than last week, but pretty steady. The average age of those hospitalized, however, continues to decline. So that's partly the vaccination groups that we've prioritized. Also that these variants are being pretty active in younger people at this point. So last week that at mean was 64 years. This week it's 59 years. That's a big decline. And then the hospital capacity this week went up slightly. So 88% of hospital beds are occupied and 75% of ICU beds are occupied. So that's a slight bump up as well. But the best news I'm seeing on this slide is looking at the deaths. for like the last month, we had been around like 30 deaths per day, an average of 25 to 30 deaths per day. And this week we have an average of 10 per day, which is where we want to be, if hopefully even lower. We really just want to get back to no COVID deaths. So I hope this can continue. But this is what we want to see as we keep prioritizing those vaccines into high risk groups. This is a great sign of what's to come. All right, so the other hopeful thing is those vaccines. So this is the state's weekly report, which is from last Thursday. Last week's vaccine report indicated about 4 million people had received at least one dose in our state, which is great. And in a month from now, those will become fully vaccinated people. So we're really making some excellent progress. And then also in last week's vaccine report, they indicated 1.5 million residents were fully vaccinated. That's about 21% of Massachusetts population overall, all age groups. And then Governor Baker announced today that they're expecting to surpass 2 million fully vaccinated people this week. So this should look better tomorrow. So let's go into Littleton data. So this is the number of cases reported in last Thursday's weekly report from the DPH. So last week, the DPH reported Littleton had 32 cases reported between March 21st and April 3rd. 2 weeks prior to that, we had 22. So not only did we rise in the number of cases, we rose into the red zone. So the cut point for that is 25. We were 32 last week. That's well above the cut point. This is Jim's sneak peek. So Jim last week reported 28, and that's no fault of Jim's. Maven's that database that the state uses is a open cohort. So people come in and out depending on when their tests were. So the fact that depends when Jim looks and when the state looks, it can vary slightly. So 4 cases isn't a big difference for these two looks into the system. But so according to Jim's count, this week we had 28 cases. 2 weeks ago, we had the 22 cases. So again, that's still higher than 2 weeks ago, and it still puts us in the red zone. So, and then I looked at all of the towns that Neshoba Board of Health covers, and there's a similar pattern. So the total number of cases for all of those towns together this week is higher than it was 2 weeks ago, and even slightly higher than it was last week. So we've got that slow up or maybe flat that the state was seeing. We're seeing it here locally too. We're back to last week's data, last Thursday's data. So this is the average daily incidence rate per 100,000 for the 2 week period. Littleton's rate was 23.4 per 100,000, which was slightly higher than the 2 weeks prior. We're going to expect it to be this point or maybe even higher tomorrow. And then all the areas around us also had trended higher as of last week. And again, the same with test positivity. So Littleton has consistently about 1,200 tests, PCR tests conducted every week. I'm assuming many of these people are people who get them every week, and it's just the same group of people every week. Our test positivity as a town was 2.88%. 2 weeks prior to that, it was 1.77%. So that was a little bit of a bump up. And then again, the state, the county, and all of our surrounding towns and areas that we've been tracking also trended higher compared to the 2 weeks prior. Some other little hints of what's happening, and also gives us little hints of what's happening in our town, is the public schools health notification letters that they send out whenever there are cases. So last week was April 5th, and Littleton had a total of 6 health notification letters, 3 at the high school and 3 at the middle school last week. So far this week, we have no health notification letters, which is great. And then there were no positive pools in the pool testing program. So the great news is we identified cases and it wasn't in the school building. So the layers of mitigation are working. And one of those being that don't go to school when sick or don't go to school when you're exposed, that is in place and it's still working. So that's a great sign, in my opinion. So both K to 8 has been back to school. I think this is the 3rd week back, 5-day. and high school started on Monday. We'll see how things go. Next week is school vacation week, so keep that in mind. All right, let's talk about the good news for town. Let's talk about our vaccines. Last week was a big jump from this. Vaccines for municipalities comes in that weekly report that the state puts out. So this is from last Thursday. The good news is, as of last Thursday, about 40% of Littleton's residents had at least one dose of the vaccine, of which about 21% were fully vaccinated, and that was right in line with what the state statistics are. And also encouraging that the proportion of people 65 and older who had at least one dose was high. It's about 80% as of last week, which is great. So remember how we were really concerned, and Ashley was saying, it doesn't make sense. People are telling me that they've gotten vaccines. She's probably right. People are telling her they got vaccines. They just got them recently and didn't make it into the prior report, which is the one we talked about last week. However, if you do the math, we're still just over 300 residents in that oldest age group who is most at risk for severe disease, who has not accessed vaccines yet. So there's still some work to be done, but the nice thing is that there's high coverage in that age group. I think nationally, the coverage for that age group is 75%, and we're at 80% in town. So these are good things. So just to summarize Littleton's data, cases and test positivity we're either holding steady or slightly higher. We're going to see tomorrow. Our rates in the state are highest in the high school age group, and then followed by the middle school age group, if you're talking schools, and those are when we got the health notification letters the prior week. So we're probably similar to the state in terms of who is getting COVID. Looking at the lagging indicators, the hospitalizations are increasing, and that is concerning, especially as the younger age group is starting to be the ones hospitalized. But on the bright side, the numbers of deaths have really changed in the last week, and I hope that remains true, just stable. And the real bright side is that the number of Littleton residents who are getting vaccinated has grown week over week now substantially. So this is all really helpful. I feel like I bring you guys up on a high and then I crash you right back down. So here we're going to crash. Here are the variants that are present and circulating in the US. And then also I can look at the mass data because the CDC just updated their website. So the CDC has been reporting that the proportion of circulating variants in the US is high, and that B117, which is this light orange group, is the most prominent variant that is circulating. It is 50% more transmissible, and as you can see, this is like every 2 weeks. It like doubles every 2 weeks, which is unfortunate. So at this point in time, as of March 27th, which is the last date that they've gotten this data, 44% of circulating variants in the US is the B117, that's the UK variant. It's also the most common variant here in Massachusetts. Massachusetts also has the highest proportion of P1 variant, that's the Brazil variant, of any of the United States. That was the variant that was responsible for the outbreak on the Cape, which is why we suddenly have a jump above where the national proportion is, averages. So the P1 variant is a concern because there's not sure if that will impact antibodies and what lower the effectiveness of either natural immunity or vaccine-acquired immunity. So there's something to keep an eye on. And then also in this week's CDC report, Massachusetts has circulating B1427 and B1429. Those are the California variants, and the ones first identified in California, which are also 20% more transmissible. And there's some concern that they may also impact antibody response. So the bottom line is variants are here, they're circulating, they're more transmissible, and they may cause more severe disease. And there's a lot of reason to just try to do our best to prevent spread. The other reason to try to do our best at this point in time when vaccines are rolling out is to not get sick at this point, is because more and more information is coming out about health impacts that are not death and hospitalization. So long-term health effects, especially. So this studies keep coming out. The one I'm showing tonight is a cohort study out of Sweden of over 1,400 healthcare professionals who were considered at low risk for severe outcomes. This was published in JAMA last week. The interesting thing about this study is they actually had a comparison group. Most studies just describe people with COVID. This one actually describes people without COVID. So you get a feel for what's the background risk for this. So 26% of seropositive individuals in this study reported at least one moderate to severe symptom that lasted at least 2 months, compared to 9% of seronegative, so negative COVID patients. The most common moderate to severe symptoms lasting at least 2 months were fatigue, loss of taste and smell, and difficult or labored breathing. And they also did a survey to look at how it impacted functional impairment, so how people perceived the long symptoms to impact the way they engage with the world. So that's what this figure is. And of the seropositive participants, 8% reported that their long-term moderate or markedly long-term symptoms either moderately or markedly disrupted their work life, compared to 4% of seronegative individuals. That's a relative risk, an elevation of 80%. 15% reported their symptoms moderately or markedly disrupted their social lives, compared to 6% of seronegative participants. That's a relative risk of 2.5. And so twice the risk. And then 12% of seropositive individuals reported that their long-term symptoms moderately or markedly disrupted their home life, compared to 5% of seronegative participants. Again, that's 2 times as high for people with COVID versus those without. So the results of this study, which had a comparison group, which is one of the good things about this study, suggests that a considerable portion of low-risk individuals with mild COVID reported a diversity of symptoms, and that those symptoms disrupted their work, their social, and their home life. So there's just a lot of reasons to try to avoid getting sick at this point in time when you're going to get a vaccine in the next few weeks. Okay, so not only do we have those more transmissible variants circulating in Massachusetts, but our webs of connections are now wider than we've seen since last March, before the start of the pandemic. So people are returning to workspaces, schools are back full time, businesses are open in phase 4, spring activities have started, people getting that spring itch and are starting to socialize more. So it is very important to recognize that our COVID bubbles have burst. They don't exist anymore, and that we are each now part of this wider ecosystem of connectivity. And it's more important now than ever before for us to use all those layers of mitigation as frequently as possible every time we leave our house, just to help slow the spread. Which leads us to the cheese. We know how to slow the spread. The same tools that we've used to slow the spread of the wild type virus all winter will also work on these variants. And we know what we need to do. We just need to keep doing it a little longer. So it's become clear that COVID is airborne. So we know which of these layers is more important to focus on than others as well. So let's talk about those layers. How are we going to do it? So given that we have more connections now than we've ever had in the past year, it's really important to keep using all those layers. So spread has been documented to happen during shared meals, sports and extracurricular activities, carpools, social gatherings and sleepovers, especially anything held indoors. So you need to choose the safer option whenever possible and layer it up. So wear masks, improve the ventilation by opening windows, meeting people outdoors. The risk of COVID spread outdoors is like 20 times lower than the risk of spread indoors. Limit the size of your group you're gathering with and the amount of time that you're spend together, and then just keep getting tested. And COVID spreads before people know they're sick. So we know household spread is common. So if someone in your household has COVID or has a known exposure, please just assume all other members of your household have been exposed as well, unless they've been vaccinated. Please don't go to school, work, or activities and seek testing until you know for sure that you're okay. And also, if someone is in your household is sick, the same layers of mitigation we just talked about, such as wearing masks, and really help prevent spread even among your family members to lower everyone's risk. All right, so one of the most critical things we can do is to get vaccinated when it's our turn. And as of next Monday, April 19th, everyone age 16 and plus in Massachusetts becomes eligible to make appointments. So please pre-register at the mass.gov COVID-19 website. It's easy, and they're saying that it takes 2 to 3 weeks to get an appointment through that system. And in that meantime, you can search for an appointment through CVS, other pharmacies, the local hospitals, things like that. So getting vaccinated is the most effective layer of cheese that we have to protect against spread and severe disease. And it's really the final layer of cheese. This is the thing that's going to make us come out of this pandemic and has the fewest holes, or the smallest holes that the virus can sneak through. So it's really important to get vaccinated when you can. I do want to pause right here for a moment to talk about vaccine safety, because as we probably all know at this point, yesterday the CDC and FDA recommended a pause in the use of J&J COVID vaccine. And of 7 million J&J doses administered to date, 6 cases of a rare blood clot called a cerebral venous sinus thrombosis that occurred in combination with a condition of low levels of platelets, or thrombocytopenia, has been reported into the early warning system that the CDC and FDA use. So all 6 of these cases were women aged 18 to 48, and their symptoms occurred in the 2 weeks following their J&J dose. So what does this mean? This kind of data review is a really critical step in the post-authorization and approval safety process for all drugs. So this is just one of those critical steps that happens with every drug that the FDA reviews. So you are seeing the FDA's process unfold in real time under the spotlight. This pause actually gives the CDC and the FDA time to notify healthcare professionals to help them diagnose and treat these conditions appropriately in the event that they happen again. And the treatment of these clots is different than the current standard of care. So taking this pause to spread awareness is really important at this point. And there may be additional cases out there that haven't been connected yet. So the CDC wants to have some time to make sure that their vaccine reporting system, adverse event reporting system, the VAERS system, has a chance to catch up and get all the data in it that they can too. So, and then finally, this pause gives the safety review board time to review all the data, analyze all the clinical information, and deliberate on potential updates to the authorization for the J&J vaccine. So we expect the FDA and CDC will come out with more information over the next week or so. I know it will come out over time. So the next time the CDC presents will be Friday. They'll probably provide an update then. But it's really important to keep in mind that these blood clot events are extremely rare. 6 out of 7 million. That's minuscule. And the CDC and FDA have the fact that they've identified the safety concern at all, and that it's being taken seriously, and signals to me that I have more trust in the system now for not only the J&J vaccine, but also the other vaccines. So they found this rare thing and they're acting on it. This is a reason to be, the system is working, is really what I want to say. So then on the flip side, we've got people who've got J&J vaccines in the last couple of weeks, many young females like in my age bracket who are all a little worried now. So here's what people need to do or know about. So for people who've already received the J&J vaccine more than a month ago, the CDC reported today that the risk of blood clot is exceptionally low. For those who received the J&J vaccine in the last few weeks, they suggest just keeping an eye out for specific symptoms related to blood clots. So that is severe headache, a severe abdominal pain, severe leg pain, or shortness of breath, all leading to an emergency department visit. If you have any of these symptoms up to a month after receiving your J&J vaccine, do not ignore them. Contact your healthcare provider. Go to the hospital if you need to. These symptoms are not the same as the mild symptoms that you'll get within the first few days after a vaccine, that dull ache, chills, fevers, headaches. But if you're not sure, contact your doctor. And most people For anyone who's scheduled for a J&J vaccine this week or next week or the weeks after, the CDC is advising just keeping your appointment because they're trying to add additional Pfizer and Moderna vaccines into those sites to give and to reschedule people if necessary with a different vaccine. So hold on to your appointment and keep trying to follow up or trying to get a different vaccine. That's the best thing to do right now. It's also important to remember that J&J is not our only vaccine available to us, so that Moderna and Pfizer make up the vast majority of the vaccines being administered in the United States. J&J is only 3%, Moderna and Pfizer are 97% of the vaccines right now. Pfizer and Moderna are mRNA vaccines, which are a different type of vaccine than the adenovirus vectors used by the J&J vaccine. The FDA and CDC reported that this rare blood clot in combination with low platelets has not been found among the 180 million people who have received Pfizer or Moderna. So this is not a safety event that they're worried about with Pfizer and Moderna, at least not at this time. There's no signal that that's an issue. Pfizer and Moderna also both have really robust real-world data, not only for their safety, but showing that they're both effective in protecting against severe disease and reducing transmission of COVID. And the variants are here, so we're still in that race against the variants, so it's really important to still try to get vaccines. So these vaccines work, they're safe, and it's important that we keep trying to get them right now. So I know this like J&J thing comes and it's like a bump on the road, but we're going to get more information soon on this. But until then, keep in mind that these events are very rare, and there's also a risk of blood clots and other adverse events if you get COVID that might land you in the hospital or otherwise. So, and those long-term health impacts. So it's, again, keep trying to get an appointment for a vaccine right now when you're eligible. And as always, if you have a question about any of the vaccines and which one you should be looking for, please call your doctor to discuss. That's what they are good at, is that individual decision making. So as I end tonight's presentation, I just want to reiterate, we still remain at that critical juncture at the pandemic. At this point in time, cases are holding this week, and we hope that they remain holding at the very least, or start to decline again, but we're still against those variants, so it could rise at this point. Test positivity has risen recently, about the same as last week. 2 weeks ago, it was lower. So hospitalizations are also rising. Vaccines are our way out of this pandemic, but at this point in time, it's still the majority of people that we come in contact with are not vaccinated. So there remains a lot of susceptible people out there that could contribute to spread. If we have a surge now, the longer it takes for our community level vaccine effects to kick in to protect our community, to lower our rates. So at this point, we just want to not go up in the number of cases. At this point, we want to do everything we can to prevent spread, even lower it further if we can. And so it remains critical to keep using all of our layers of mitigation every single time we leave the house so that we can, by 4th of July, have a different setting here. And by doing everything we can do now, we can have a great summer kind of thing. So where we are this week.
Thank you for all that. That was really interesting about the J&J. So I have a question about the variants. How do we know? Are they testing for the variants after do they call you back and say, hey, you have this variant? Does it matter, or does it not even matter? Your COVID.
I don't believe an individual is going to find out which version of the virus they get. I don't believe that the system's set up to notify you that, hey, you had the B117. It takes about 2 weeks, from what I've seen, for the samples collected in each state to go through the testing process and the reporting process. So by the time you actually would have that information, it's old news anyway. It's not actually helpful to an individual. Does that make sense? Whereas it is helpful to know in the state that we have 40%, 50% of the UK variant, we have 4% of the California variant, and we have 3% of the P1 variant circulating, because that's a majority of them are variants. So yeah, I don't think it helps an individual to know which one they have, but it is helpful to know on a population level that we, especially with exponential growth, that like in 2 weeks, we're going to expect B117, the UK variant, to be 75%. You know, actually right about now is when they close the next period. So we'll find out at the end of this month what's happening right now. We're always 2 week look back on that too.
I just also wanted to just comment on that marked effect from the negative and the positive.
Yeah.
The one at home, the home life. That was like, okay, what does that mean?
I know. Yeah.
Everybody sick of each other.
I can't deal with my kids is how I take it. Like if I get sick, it's going to be hard for me to like cope, I guess.
Yeah.
The laundry would get harder. Making food would get harder. Those kind of things. Yeah, that's actually a standardized questionnaire that they used. So that is, it's been one that's been tested and approved. It's it's actually a good tool.
But it was like, what are you affected? And the people that didn't have it were also being affected about the same amount.
Well, that was
a little bit less.
Yeah, a little bit less. Actually, and if it was mild disease, a lot less because it wasn't bugging them. But yeah, I think that was actually the beauty of that study, is that there was a comparison group. You can imagine that like anything could kind of set you off. Like I hurt my back. Well, that would impact my my functionality at home. But that gives you the background rate to compare against. So I thought it was, it's not is it the perfect study? Nope. But it gives you an idea of these things. These long-term symptoms may seem like, I just couldn't smell for 2 weeks. Well, I can't smell my food to taste it, or I can't taste my food. There are things that that can really mess with somebody.
I saw on the news that there's somebody that's written a cookbook for people that have lost their taste, their sense of smell.
Really?
And I guess chocolate and garlic are two things that you lose the longest or the first or something like that. So somebody try and sell another cookbook. So.
I saw somebody did a fun analysis of Amazon reviews on scented candles. And as of last March, scented candles started getting really bad reviews about not actually having a scent. And when you looked at the number of people who had COVID, it actually correlated really well. Correlation's not causation, but it was like, oh, there's a time issue here.
Sounds like another Amazon truck story. All right.
Yeah.
I have a question. Just to refresh. I'd like to mention something called a wedding. if just for a moment, and maybe Katrina can help. I believe the current limit on the number of people for an outdoor wedding is 25. Is that correct? Or is it 50?
I think if you were in a private setting, it's 25.
Outside private setting.
Outside private setting, the maximum, any private setting, the maximum is 25. If you're at an event venue, it's higher.
Now, this is why I have you here, Katrina, because I'm going to give you the scenario. It's practically an estate. We're talking about 2-3 acres. I mean, it's not a lot, but it's open. Does the 25 still hold, or are you allowed more in if they can stay away from each other by 6 feet?
Is it a private setting?
Private setting.
Then I think it's still 25.
Thank you very much. I don't have to go. All right, next. I'm going to be the Charlie
I guess
Brown.
like that Jim would be the person for that.
No,
because there is a difference between not private and private.
It's okay. I'm always looking to get out of those things. This is more of a Charlie Brown moment, okay, which just shows you the different worlds. Within hours of the announcement that there was a pause on the J&J vaccine, the number of people getting vaccinated around the world began dropping because the number of folks who were getting vaccine, they started leaving the line. And this is different countries around the world. And what I'm suggesting is, just like we always tell ourselves that Littleton is not in a bubble, this country is not in a bubble.
Right.
So the J&J thing to us may seem perfectly reasonable, logical, and nothing to get too, shall we say, too frustrated or concerned about. But in other countries, this is a sign that something's really wrong with the whole thing. And so at the moment where there is widespread vaccine doubts and resistance, this announcement has fueled it, even though it's maybe not logical.
So I think that's a really good point. So the United States has the majority of our vaccines are the mRNA vaccines. So that's Moderna and Pfizer. That's what's being supplied here in the US. Other countries in the world are predominantly getting the AstraZeneca and at least AstraZeneca, and I think Johnson & Johnson, and they're both the adenovirus vaccines, and both of them have had this clotting event come up, which makes sense. It sounds like a class issue, like a class of the way the virus is working. So when we think of protecting the US, we're not done when we finish vaccinating everyone in the US. The chance for like COVID to like catch fire and mutate in other areas of the world and then be transported here and escaping our vaccines is still existing. So this concern about, on a population level, this concern about people not getting these vaccines is real. And so it's unfortunate. I think there'll be advisories. We'll keep working on it. I did see, conversely, Mike, that U.S. Health and Human Services has this vaccine, some modeling for amount of hesitancy among people in the U.S., and Massachusetts is very low in hesitancy. So that is hopeful for our area. Other parts of the U.S. and New England in general has low amounts of hesitancy. So I feel like if we can keep this going for the Pfizer and the Moderna, we're in a good area of the U.S. There are other areas that are much higher in the vaccine hesitancy, but we have to just keep working on it. To me, I totally get the women who I know who got J&J last week who are like, oh my gosh, what do I do? And it's like, here are the symptoms, and you wait, and it's 6 out of 7 million. It's rare. But I understand that concern. I think after listening to the FDA and the CDC today, I'm feeling confident that they've got this well under study right now, and that we're going to have some clear guidance soon. But anyway, we can encourage people who don't want the vaccine to get the vaccine is good.
Yes, absolutely.
Any of the vaccines.
Yep.
Great. Does anybody have any questions for Katrina?
Wait till next week.
I'm not here next week.
You're not. Well, let's wait for the week after. It'll be even more.
Okay. Yeah, I can't wait to celebrate 2 weeks.
Wow.
Post vacation too.
Yeah.
I'm going to relay all my phone calls to you, Katrina.
All right. Anybody have no questions for Katrina? COVID update. I'll say Dave from LCTV told me today that the Kevin Davis, the setting on the state just opened up that symptom, what is it called? The exposure notification on our phones has been opened up for the state for a certain amount of people.
For the whole state,
So
or just
that's
Methuen in Somerville?
I don't know. I don't know the details. I did it while Dave and I were talking, so I was able to set it up. So I don't know if Kevin is he around? Probably not.
He's not here, but I spoke with him today, and I'm sure he would have mentioned it if. Let's check it out.
You want to text him?
I just texted him to see if he's around.
See if he knows anything. Okay. All right. Does anybody else have anything about COVID that they want to talk about? Anybody else? I think we were. Lynn Snow's not here, right?
Yeah, Lynn's not here. But I had sent you some information about the pool testing.
Yeah, I haven't had a chance to read that yet. I just got that this afternoon, so. There's somebody with their hands up.
Can you hear me?
Done?
Yeah, hi. This is
State your
Linda.
name, please. Yeah.
What?
State your name and address, please.
Yeah, this is Linda Stein. I'm the chair of the Historical Commission, and this is COVID. This is COVID related. I don't know whether you want me to talk about it now or later. We're having an event that I talked to Jim Gareffi about.
Yep. Can you hold off just for a second, Linda?
Sure.
Thanks. So Kevin and I were talking about, well, we have Louise has Louise, were you able to send that letter to Janet and or Mike Fontanella or?
Yes, that was mailed out.
Awesome. So I don't know if they're going to look at it at their meeting or just one of them is going to review it and then we'll have that sent out to the school community. And then can we adjust that and make it to the go to the general public and have Anthony send it out?
Yes, yeah, I'll do that.
Hey, it worked. The exposure notification. We should have Kevin.
Yeah, no, I got it.
Great.
All right. So that was all I had about the email blast. And Katrina answered the question about pool testing, that it's done pretty well so far. And I think we've got that email blast, suggesting and urging parents to get their kids opted into that so that they can use more of that information. Anything else? Anybody?
Nope.
Good job.
Okay. All right. I guess we're ready. Maybe we're ready for Linda now. Sorry, Linda.
Actually, there's a hand up now. Oh, did he just put it down? Sorry. Robert Saborin, do you still have a question?
Oh, he was the gentleman that had the it was on our, it's not on the agenda. The Janet, what's it? That Jim had to speak to.
Oh, okay.
The
Robert, I've already heard from your engineer and he's going to get in touch with Jim.
Mr. Warren. Did he get off?
Okay. Did you want Linda Stein now?
Yeah, sure. So everybody, that was Mr. Saborin was here for a question that Jim was talking about, that he's going to have to Jim's going to have to go over it with him a little bit more on the 32 Mill Road septic system. So. All right, Linda, go ahead. Sorry again, if you can state your name and address.
You're muted, Linda.
Okay. Can you hear me now?
Mm-hmm.
Do you want my video or not?
Yes, please.
All right. All right. So there I am. All right. So as I said, I'm the chair of the Historical Commission. Every year, the commission has a Patriots Day ceremony on April 19th. Last year, we canceled it because of COVID. This year, we decided to hold it. And I spoke to Jim. He called me. We had a good conversation. And he suggested that I come before you to tell you what our plans are for COVID safety. And he had a couple of other things that he suggested we do, which we will do. So it's an outdoor ceremony. It's at Liberty Square, which is on the border of Boxborough and Littleton. We're expecting at the very most 50 people, probably more like 20 or 30. I believe the limit is 150 for an outdoor event in public. we're going to announce up front that COVID restrictions have to be met, wearing masks, social distancing. We'll have signs up at the perimeters about social distancing and masks. Jim suggested we put up stakes or some sort of markers. So we'll put up markers for 6 feet social distancing. We'll put signs on some of those. We'll have a microphone so people don't have to huddle to hear. There'll be a couple of short speeches. Basically, they're placing wreaths on memorials and having, as I said, a couple of short speeches. Taps will be played on one instrument and the instrument will be away from the people. And I think that's probably it.
Linda, how, I know you said you probably have about 20 people. How would you expect to control the crowd if there was more than that?
Well, we don't know how many will come. We never get more than about 50. And I think because of COVID, it's going to be, and we often get less than 50. We usually get more like 20 or 30. So I'm guessing this year will be even less. If it is a large crowd, we'll have to social distance even more.
Okay. Mike, did you have a question?
Yeah. I don't know if you've sent out the announcements yet or have done anything at all, but may I suggest that you include in your materials immediately that you're only going to allow N number of people into the venue? I mean, otherwise you're stuck with the policing effort.
Yeah.
Just put a cap on the number of people that that you could actually accommodate easily in that space by putting out the stakes, and don't try to go to the full limit unless you for whatever reason feel it's necessary.
That's a good idea. I'm not sure how, we're not really sending out announcements. We don't want to do a lot of publicity. It was announced on a local cable TV station. We may be putting up a couple of large banners.
I was thinking you could do it. I'm sure you have a membership list and an interested party list. So that an email blast is about the best you can do at this stage. I think reminding people of the limits on public events is crucial for any organization at this time. I mean,
Right.
It shouldn't really be an option. I mean, everything from, professional to amateur to any kind of public gathering, the first thing they do is send out an announcement saying, we can only allow N number of people into the venue, period. Don't show. The first, I mean, I'm making up the number, but the first 25 and that's it.
Yeah, we don't really have we don't have a membership list. People just show up. I mean, it's a good idea, but I don't know how we would let people know.
I mean, it's what I'm just talking about here is the risk, the risk and compliance issue.
Right.
Evan, do you have any ideas about this?
I just had a funny thought about someone riding around on a horse and letting people know, but it's...
That was my thought exactly.
Any volunteers?
No, I mean, I think the area is probably large enough that folks can social distance and everybody,
Right.
as long as everybody's knowledgeable about the current state.
How many, shall we say, private abutters are there to this venue? I'm trying to remember.
Liberty Square?
Yeah, Liberty Square. There are private houses. They're not right near the area where we are, but there are private houses further out.
So the picture I'm painting here, I'm not trying to get you to cancel anything, is cars are parked.
Right.
Where N is a larger than number of cars that generally park in that neighborhood anyway, right?
Right. The parking is not right in front of the houses. It's on a street that isn't really where the houses are.
No, I am not suggesting that you're going to cause congestion for the residents. I think you're going to attract attention of the residents. So therefore, if they see a crowd, a question might come up. Why is there a crowd? Should there be a
They'll
crowd?
know. We've been doing this for like 30 years, so the residents know that we do this every year on April 19th, and some of them come to the event.
This is
Linda, do you
Linda,
have a
you're missing
police
the
detail?
drift. This is not ordinary times. All right.
Linda,
I know that.
Do you have a police detail, Linda, set up?
We don't. Should we call the police?
You probably should. Just have
Okay.
one police officer there.
Yeah, somebody coming, yeah.
Yeah, just in case.
Yeah, that's a good idea, actually.
Instead of you with a bullhorn, it might be better with,
What's
police.
that?
Instead of you with a bullhorn, it might be better with a police officer there.
No, that's a good idea. We hadn't thought of that. We'll do that.
Or just get a volunteer with a blue cap on, telling people not to come in after the count. Do a body count and then just stop it after a certain number of bodies come in.
I still like the Paul Revere idea, but
I know. It'd be very dramatic with the horse. Yeah, I got you.
Okay.
good luck. I hope you have sunshine.
Yes, we're supposed to. Thank you.
Great. Okay. Any other questions or comments?
No, I go there every year. It's really nice, and also not many people go there too anyway. I hope she has a good luck.
All right.
Thank you.
All right. Great. Thanks, Linda.
Okay, take care.
All right. Anybody from the board have any correspondence that they want to talk about at all?
I just wanted to know when it's going to stop wearing the mask. And also the pandemic is going away and never come back again.
Somebody wants to know that?
Years,
A lot of people
Yeah, not for a while.
keep asking. I say you got to be patient.
Get vaccinated.
Right.
I did. I tell a lot of people to go get vaccinated. Oh, I don't know. I can't get it because it takes so much time. I say, keep trying, man. That's it.
Good. Glad you're vaccinated, Gina. All right. Moving on to the minutes. I don't believe I saw those.
I didn't see him either.
I thought I sent them out last week. Did
Were
you?
they a
not?
part of the packet?
No, when I did them last week. We can save it for next week since nobody's read them then. I'll send it out again.
Don't send them out again. Let's just see what was the date. What date did you send them out, do you think, Janet?
On the 8th.
Did anybody see them, or is it just my bad?
I feel like I did get that email, but I just can't find it in my inbox right now. I'm searching.
I can't remember.
All right. Maybe
That's fine.
send them.
We'll add it to the next week.
Okay, move back to next week. All right. Any any member comments?
Did you want me to comment, Lisa?
Yeah, definitely.
No, on the Magnus Opus. No, yes.
Getting smaller and smaller as
Oh, it's getting microscopic. All right, I'll do this real quick. As all of us here know, several weeks ago we agreed that it was time for the Board of Health to move along and see if we can't arrange for a Littleton Director of Public Health and a sanitarian to take us into the new century. So in connection with that, I was charged with preparing a communication letter of the request to the select board, requesting that a request for the termination of the relationship with the current supplier of public health services, the Neshoba Associated Boards of Health, be terminated, and that we begin the town begins the process of search and hire so that we can form our own public health department with the director. That letter is ready to go, and it contains all the elements that we have covered and discussed. There are no surprises. They're all standard for any department in the town. So the main thing is getting this in front of the public and having it appropriately financed.
We have a public hearing about it next meeting and take a vote on it.
We could certainly do that. I mean, it's up to Lisa. I mean, the idea is to get it in front of the, we can do a parallel thing. We want to put this in front of the select board so that they can to vote to include it. It's primarily for them a financial issue, not an issue, but it's a financial operation. That's where the select board comes involved. It's really up to us to determine whether or not,
Is there an
to
opportunity
proceed.
for board member input before?
I'm sorry?
Is there an opportunity for board member input before it goes to the select board?
You mean how much money and how
No,
much?
no, just to take a read of the letter that we're submitting to the select.
I mean, I'm not trying to hide anything from you, but it's basically saying what you, I mean, I can sort of give you a rough idea of what it is, and we can sort of, we don't have to discuss it.
Mike, you don't want me to edit it for you?
Well, then edit.
I'd love you to edit to one page. I mean, I've enlisted so many people to, I mean, I wrote it large to get people to cut it, and it's taken me a long time to get people to cut it back.
I'd love to give you some feedback on it if you wouldn't mind sending it over.
No, Kevin, you're the last person I want to add. No, I'm teasing.
Sorry.
No, basically what it is, we're going to take the money.
Gentlemen.
No, we're not. We're kidding. Come on.
I know.
Yeah. Basically what we're doing is we're going to be taking the funds that we get that the town gets assessed every year. And by the way, this year's going up to another number, going up by 5%. And on average, that's about $40,000 approximately. It's actually 39,900 something this year or next year. And on average, just based on the fees that are very difficult to find out what they are for other reasons, there's another average of $80,000 per year in fees that are totally retained at the moment by the Neshoba Associated Board of Health. So you take those two numbers and it comes out to be roughly $119,000 a year. So it's probably a low estimate. It's very dependent on how many people want to put swimming pools, move sheds, change their, or have their, it's basically mainly coming from sewage fees. I'll call them sewage related fees. But that of course is only part of the job. The other part of the job, there's about well over 70. Anybody picks up the manuals or the general laws of Massachusetts, we are an extension of the Massachusetts Board of Public Health Service. So we are basically we're the the outpost for them in Littleton, as it were. And there are about 70 other things that don't generate fees that, as you know from hearing Jim and having contact, that occupies another portion of the work. So we've been doing all this with basically a very good but part-time person.
Right.
And there's already evidence that it's tough to cover all the bases given what's going on in Littleton.
That's all understood. We all know that. I think the bigger picture here is that, we want to make it very clear and concise to the select board that what we're looking to do is capture those fees and those revenues at a board.
That's very obvious. That's it.
And actually utilize those to build our department, hire a director of public health, hire a sanitarian, have a budget to make partnerships and actually move the chains forward and make progression as a board of health. And I just want to make sure that's clear and stated in the letter. So if you
I can assure you it's
mind sharing that with all the members of the board of health before you send it over to the select board, I think that'd be appropriate and appreciated.
Well, I have no difficulty in making sure it's available to you.
Thank you.
But just as you know, my ambition for editing has dropped to a new low.
I'm not going to edit anything either. I just want to read the thing before you send it on my behalf. Our behalf. I'm sorry.
I think that's appropriate. And do you think that's something we can do on our own before the next meeting? Just give our input, or get it sometime in the next week and then read it and approve it so that we can send it off. So they can maybe have it before Monday, for their Monday meeting.
Oh, yeah, I should
I
finish.
promise I'll turn it around and give any
I'll
comments.
send it off to you, Lisa, and then you can
Okay.
distribute it as you see fit.
Okay, great. Thanks for all that work too, Mike. I know that's not been easy.
Yeah, thank you, Mike.
Well, a lot of digging around because nobody keeps records.
Or they went up in the fire in 1955. And,
No, there's no fire.
yeah, there was a fire.
Well, I'm sure there was, but this was nothing to do with a fire.
Okay.
Yep, apples and oranges, right?
Yep.
Okay, any other member comments?
I just had one comment that I think we should have a really serious discussion about mental health in our community and what we can do for various age groups and populations in our town to try and provide some programming, partner with folks that can provide programming. I know there are a lot of federal grants out there and different organizations that would love to get something started. And I think with a partnership with the Board of Health in conjunction with different sponsorships and things like that, we could make some progress and do some good for public health. So if you'd entertain a discussion on that at our next meeting or sometime soon.
Sure. I think that's a great idea. This pandemic has created quite the stress on the mental health system and mental health of people, period. So I think next week is our...
Lisa, can I make a comment?
Yeah.
I'm sorry to prolong everybody's agony here tonight, but public health, I just want to tell you that according to the rules of there's nothing wrong with wanting to address the issue of public health. It might be very clear to know that as far as mental health, but in the context of public health is an activity of prevention. It is not a cure delivering operation. It's not a cure delivering facility.
Prophylactic.
So in other words, I'm not trying to diminish the agony and the difficulties that people have in any case related to COVID or any other disease. But in terms of being able to clinically address disease, we have to be very careful that we don't, it's not that we shouldn't, we should have to be aware of our boundaries.
Are you overlooking like suicide prevention and you're overlooking drug addiction and all these other things that come along with the mental health problem here?
Well, we can discuss it.
We'll discuss it.
Okay.
Yeah. Let's look into ways that we can help mental health by public health. Okay. Any other comments? And I don't mean to shut you down, Kevin, but
no. Shut Mike down sooner. That's all. Jeez.
Sorry?
You don't ever shut me down. I'll just
be
somewhere else behind you. Go ahead.
Even when it makes sense, I know.
And I think next week, Janet, correct me if I'm wrong, is next week just a COVID update?
It is, yes.
Okay. So if we can maybe gather up some information, see if we can kind of put the 2 and 2 together and then have a little bit more information to discuss it in 2 weeks. Kevin?
I'm sorry, I can't hear you.
If we can, so not next week, because next week is just our COVID update, but the week after that, if we can find a way to tie both public and mental health in and maybe have a little bit more.
I mean, mental health is public health, so it's all in the same. If you want to skip a week.
No, next week is our COVID update.
And that's all you want to do.
That's what we're trying to stay on that track. So.
21st.
Okay. All right. Any other comments? All right. Any public comments at all? Any hands raised?
Yes, there's Amy Tez has her hand up.
Okay, Amy, if you can state your name and address, please.
Hi, everyone. Amy Tez, 117 Whitcomb Avenue. I just wanted to offer up a comment about mental health as it relates to public health. I am a practicing psychotherapist, and I've actually been talking at school committee to ask for some more information about supports that are available to students, but also to families in the community. And I've been, just trying to think a little proactively with people in town to see what we have as supports for people. So I really appreciate, Kevin, I appreciate you bringing it up tonight. And Mike, I would say to you that I think I completely understand where you're coming from. I think it's not about clinically diagnosing and treating people, but on the preventative front, if we can help stem the tide of people looking for more intensive support right now, because the fact is that there's just not enough providers to deal with the more intensive issues. And even for people who are ending up in crisis, there's really a gap in services available. So, I think as a town, it would be good for us to try to bridge gaps. And even if it is just that you as a Board of Health are helping convey information over, I mean, that's something that's really big too. So I'm excited to hear what you gather, and I'm actually happy to offer up any other kind of information if you're looking for anything. But, I appreciate that you're going to add this to a future agenda.
Might be reaching out for your help, Amy, if you don't mind.
Yeah, absolutely.
Awesome. Okay. Any other public comments?
Yeah, maybe we should invite her so she can be a speaker, and maybe she can give us some suggestion. It will be a wonderful thing to have, and then we can work from there.
Sure. Amy can be our Katrina.
Correct. If
That's
she
a
doesn't
high
mind
bar.
doing it.
You got those graphs, Amy? Can you make some
I
graphs?
don't have graphs. I'm sorry.
You'd be happy to know, Amy, that already,
Graphs are pretty impressive.
you'd be happy to know, Amy, there's already a group of of psychotherapists and psychologists who are getting together to assist the psychology and the psychiatrist community from burnout.
Yes.
Doctors
Yes.
for doctors, yes. Therapists
Yeah.
for therapists.
Well, it's true. It's true.
Yes.
We're a year in, and we're all sitting in the same with the same issues. So anyway, much appreciated that you're bringing it up. So thanks again.
Thanks, Amy.
There are two other hands raised.
Okay.
Dan Kane.
Yeah, Dan, state your name and address, please.
Yeah, good evening, Dan Kane, Whitetail Way here in Littleton. I had a quick question kind of following back to the establishment of a Town of Littleton Department of Health. And it sounds like the letter has been drafted, which is wonderful, but it was addressed around a department chair or a department director and a sanitarian. I didn't hear any discussion around public health nursing, physician relationships, and some of those other pieces that are required for a Department of Health to be effective. That number of 119 of fees going out certainly would not probably be adequate to cover a director, a sanitarian, as well as a clinical component. And I was wondering if that was included in this plan and how
It is. And the big issue there is, and unfortunately, the amount of, shall we say, utilization of nursing services versus, we just don't have data on it for, I'll call it, unfortunate technical reasons that have nothing to do with the Board of Health. But it is included as one of the hires, but it has to be determined based on a different kind of assessment of what's needed going forward, but it's there. It's part of the package.
Okay, because that wasn't discussed at all earlier, so I want to make sure it wasn't.
No, it wasn't. It wasn't mentioned because the assumption here is that the kind of basically what we're doing is replacing what we have on a part-time basis from the Neshoba Association of Boards of Health. We're basically replacing that with a Littleton-specific operation. So that would basically be this, what we'll call the same kinds of personnel, but they would work directly, exclusively for Littleton.
No, I think I understand that part, but I didn't hear a nursing or physician.
I didn't mention, I'm just assuring you that's part of the package.
Dan, to give you a straight answer, what we are have spoken about is to actually supplement the nursing services that Neshoba Associated Boards of Health supplies to us currently, and keep those as a part of our system.
I don't think there's a problem. That's one of the things that had to be investigated. We may be able to get nursing services on an as needed basis, but there's a problem with dealing with Neshoba in regard to any, shall we say, supplements.
Dan's a great resource as far as nursing goes. So,
yep, I got that when I saw the RN.
Yeah, I was really just trying to make sure that certainly is a challenge. It's one of the mandates for any board of health or department of health is not just prevention, but it's also, obviously, as we well know, after the last year, contact tracing, which would fall under the department responsibility, immunizations, lead testing. There's a number of clinical components that also are part of the practice that I had not heard included in that higher plan. And I was just really curious about that. I also mentioned that I heard that there was going to be a discussion of a public hearing on this, but then about the letter, and someone mentioned a public hearing. And I was curious if that was going to be going forward on the agenda at some point.
I don't think we're going to have a public hearing. I think our letter of what we're recommending is going to the select board.
Okay, thank you.
I don't think we'll have a public hearing about it. We've had meetings about it, and and Mike has been charged with kind of summarizing what would work for us and what would hopefully work for the town of Littleton.
Okay, great. Thank you.
Janet, you said there was somebody else with their hand raised?
Yes, Kevin Davis.
Hi, can you guys?
Kevin, just for the record, state your name and address, please.
Yeah, Kevin Davis, 35 Whitetail Way. Good evening. I heard through a little bunny came and told me that Mass Notify as our new exposure notification app was turned on. I heard you guys may have had some questions.
Dave at LCTV told me that it was activated, so I've activated myself.
Oh, that's great. I'm amazing that Dave brought that forward. I just saw an announcement that came out, and it's kind of cool that it's been turned on. So this is really great news.
Good.
So for the state of Massachusetts, for those that don't know about it, I'd be happy to put some information together for you guys so that you guys can take a look at it, and maybe we can talk about it next week so we don't prolong this meeting anymore. But I'd be happy to answer anybody's questions about it. This is the exposure notification that we talked about a while back in the beginning of COVID, like the October, November timeframe. So I'll be more than happy to talk about this next time.
Awesome. So next Wednesday, can you come? Because we'll have just a COVID.
Yep. I can be there next Wednesday. Yep.
Awesome. Great.
You shoot a how-to YouTube video that we can.
I will be more than happy, but I know also the state, I'm sure will have some resources that'll do this. But this is exciting news. I'm really, really proud of the state for stepping up and doing this.
Yeah. Do you suppose there's a slide that we can put on TV also?
I'm sure we'll find something for that. Yeah, we'll get something together.
All right. Maybe we'll see if we can change some of the blinky signs.
Oh, that'd be great.
See, because that would not just be people from Littleton, but people driving through, up 110, up.
Totally.
Yeah, if they're driving slow enough. All right. Thanks, Kevin.
You're welcome.
All right. I'll set with public comments and member comments.
That's it.
That's
All
it.
right, so next meeting is next Wednesday, the 21st, and at 7 o'clock, and it'll just be a COVID update with no public hearings. So,
Thank you.
all right, motion to adjourn. Oh, and minutes from the 7th and today to do.
Make a motion to adjourn.
All right, second.
A second.
Good. So Kevin Baker,
Kevin Baker, yes.
Gino Carloni,
Gino Farrell, yes. Thank you.
Louise Nichols,
Louise Nichols, yes.
and Mike Zeldin.
Mike Zeldin, yes.
Yes, and Lisa Flanagan, yes. All right, thanks, everybody.
Have a good week.